Imagine yourself transporting back to Victorian London in 1859. The air is thick with the scent of coal smoke and horse-drawn carriages clatter on cobblestone streets. In a quiet, respectable doctor's office, a woman named Mrs. Ainsworth sits across from her physician. She describes a litany of troubling symptoms: a constant gnawing anxiety, restless nights, sudden fits of irritability, and what she vaguely refers to as nervous episodes. The doctor, a man of science and adherence to the medical wisdom of his time, nods gravely. His diagnosis: hysteria. For over 2 millennia, the concept of hysteria plagued women, a catch-all diagnosis that evolved from an ancient Greek belief. Hippocrates, the father of medicine, coined the term from hystra, meaning uterus. He and countless physicians after him believed a woman's womb could literally wander freely within her body, pressing on organs and causing a myriad of ailments, from anxiety to fainting spells. Plato even described the uterus as an animal within an animal, desperate for procreation. The supposed cure for this restless organ: marriage and pregnancy. By the Renaissance, the wandering womb theory was largely dismissed, yet the diagnosis of hysteria persisted. Its symptoms expanded to encompass virtually any female complaint: nervousness, insomnia, muscle spasms, shortness of breath, loss of appetite, depression, and even behaviors deemed troublesome or unfeminine. Essentially, if a woman deviated from the ideal of quiet compliance, she was likely deemed hysterical. Prominent physicians, like the English Dr. Thomas Sydenham, estimated it to be as common as fever, affecting 1/4 of all women. Victorian medical theory painted women as inherently delicate and nervous, their reproductive systems dominating their entire physiology. This belief system led to a massive oversight: the complete denial of female sexuality. Dr. William Acton, a highly respected Victorian physician, famously declared in 1857 that the majority of women, happily for them, are not very much troubled with sexual feeling of any kind. This pervasive notion meant that when women sought medical help for what we now understand as sexual frustration, doctors interpreted their distress solely as illness. The treatment that emerged was pelvic massage, performed by doctors to induce what they clinically termed hysterical paroxysm. We now know this was, in fact, an orgasm, but in their minds it was a purely medical procedure, no different from setting a broken bone. Physicians documented the process in purely clinical terms, describing violent contraction and relaxation of the muscles, accompanied by flushing of the face and a feeling of relief from symptoms. Imagine the scene: a woman, often weakly, would lie partially undressed but modestly covered on an examination table. The doctor, using scented oils, would manually massage her vulva. Medical texts recommended continuing until the patient experienced paroxysm, described as sudden muscle contractions, flushed skin, and copious vaginal lubrication, followed by profound relaxation. Doctors genuinely viewed this as an arduous task. Dr. Russell Trawl, in 1903, complained that achieving hysterical paroxysm could take over an hour, calling it the most tedious and demanding of medical procedures. This treatment was astonishingly common. By the late 1800s, up to 75% of American women were believed to suffer from hysteria. Some doctors in major cities even specialized exclusively in hysteria treatment, seeing dozens of women daily. Wealthier women could even arrange for house calls, but perhaps the most popular alternative was hydrotherapy at specialized clinics. Women would sit on chairs with cutouts, while attendants directed high-pressure water jets at their genitals, a practice the French called la douche pelvienne, the pelvic shower. These water cures at European spas promised complete restoration of feminine vitality. By the 1880s, physicians like Dr. Joseph Mortimer Granville faced a significant problem. Their hands were cramping from the sheer volume of hysteria patients. Manual pelvic massage was exhausting work. Granville's ingenious solution was the first electric vibrator, a device that used an electric motor to create rapid vibrations, drastically reducing treatment time from over an hour to mere minutes. While Granville intended his device for male muscle disorders, other doctors quickly adopted it for hysteria. Within a decade, the market was flooded with dozens of vibrator models. The Weiss Company catalog from 1906 featured over 20 different versions, and medical journals proudly advertised their efficiency. By 1900, vibrators were the fifth most common electrical appliance in American homes, appearing in catalogs alongside toasters and sewing machines. Advertisements, while medically proper, were remarkably suggestive, with one 1910 ad proclaiming, "Vibration is life." The secret of the ages has been discovered in vibration. The White Cross electric vibrator brings the essence of life itself to your very door. Here's the truly astounding part. Nobody involved, from the doctors to the patients, seemed to understand the sexual nature of these treatments. Doctors wrote detailed clinical papers about inducing hysterical paroxysm without ever connecting it to sexual climax. Why? Because Victorian medical education completely omitted female sexuality. The clitoris was barely mentioned, if at all, often labeled as a small vestigial organ of no particular function. The willful ignorance was staggering. Dr. John Harvey Kellogg, the serial inventor and staunch anti-masturbation crusader, even treated hysteria with vibrators at his sanitarium, completely oblivious to the irony. Physicians would spend their days giving women orgasms as medical treatment, then return home to wives they genuinely believed had no sexual desires whatsoever. The cognitive dissonance is truly mind-boggling. While doctors remained blind, some women subtly hinted at the truth in their diaries. One anonymous woman in 1892 wrote, "My weekly appointments with Dr. Harrison have quite restored my spirits. I find myself looking forward to Thursday afternoons with great anticipation." Women recommended their doctors to friends, creating networks of patients seeking this peculiar, yet effective, relief. The medical establishment's blindness to female sexuality had other dire consequences. Doctors performed clitoridectomies to cure masturbation, even cauterizing the clitoris with acid. Dr. Isaac Baker Brown, president of the Medical Society of London, removed the clitorises of patients as young as 10 to treat hysteria, eventually being expelled from the society, not for the procedure itself, but for performing it without consent. The hysteria industry boomed, with American doctors earning an estimated $18 million annually, over $450 million today, from these treatments by 1915. Manufacturers produced increasingly elaborate devices, some even built into furniture. The beginning of the end came with Sigmund Freud. While his theories were flawed, he at least acknowledged that women possessed sexual desires and that hysteria symptoms often had psychological rather than purely physical roots. By the 1920s, the diagnosis of hysteria began to fade from medical texts. But the final blow came from an unexpected source: early pornographic stag films of the 1920s. These films began showing women using vibrators for clearly sexual purposes. Suddenly, the respectable medical device became associated with taboo sexuality. Vibrators vanished from doctors' offices almost overnight, discreetly disposed of. The Sears catalog dropped them by 1925. The diagnosis of hysteria officially disappeared from medical texts in 1952, but its legacy endured. Women reporting legitimate medical concerns were still often dismissed as hysterical or emotional. It wasn't until the 1960s, with the pioneering work of researchers like Masters and Johnson, that female sexuality was finally properly studied. They uncovered what those Victorian women intuitively understood, but couldn't articulate. The hysterical paroxysm doctors had been inducing for centuries was simply an orgasm. Looking back, this entire episode seems almost unbelievable. How could trained medical professionals remain so utterly blind to something so obvious? The answer lies in the immense power of cultural blindness. Victorian society's absolute denial of female sexuality created a distorted reality where doctors could literally provide women with orgasms all day long without recognizing what they were doing. Dr. Rachel Maines, who extensively researched this bizarre history, highlights the incredible irony. Victorian doctors were inadvertently providing the only sexual satisfaction many women received, all while believing they were treating a disease caused by a lack of sexual satisfaction. The women who eagerly lined up for treatment knew something their doctors didn't. That hysterical paroxysm was a bright spot in lives often devoid of sexual pleasure. The numbers are staggering. Over 70 years of peak hysteria treatment, roughly 1850 to 1920, millions of women received regular pelvic massages. If we conservatively estimate that 10% of adult women received treatment, averaging 20 sessions each, that amounts to tens of millions of medically administered orgasms, all performed by doctors who had absolutely no idea what they were truly doing. This bizarre chapter of medical history serves as a powerful reminder of how completely medical practice can be warped by societal assumptions. These weren't fringe practitioners, they were respected physicians trained at the finest medical schools, following accepted protocols. Yet, they were so blinded by their culture's denial of female sexuality that they couldn't recognize the obvious truth literally at their fingertips. The next time someone dismisses women's health concerns as hysteria, remember this. For centuries, the medical establishment was so ignorant of women's bodies that they accidentally invented vibrators while trying to treat a made-up disease. They were so convinced that women had no sexual desires that they couldn't recognize an orgasm even when they were causing one. What do you find most shocking about this story? The profound medical ignorance, the pervasive cultural blindness, or the sheer irony of vibrators being a common tool in Victorian doctors' offices?